CABI is an international organisation. We're owned by 48 member countries worldwide, and we have centres in 16 countries across the world and about 400 employees. The Plantwise initiative, which we have won the award for today, started up actually in very small scale back in 2002, where we were looking at the problem of how we got good advice to farmers in poor countries to help them improve the yields from the crops they were growing and improve their incomes. And the challenge is really an innovation challenge, and for us innovation is fundamentally about putting research into use, practical use, so that people get benefit from it. So we developed a concept that was called plant clinics, and they were based on the model of primary human health care, the same way that we go to our general practitioner if we have any sort of a health problem as the first port of call. So we developed the concept of the plant doctor and the plant clinic, where farmers could bring examples of sick plants and get a diagnosis of what was wrong and a prescription from the plant doctor of what they needed to do next. By about 2008, we were beginning to see some really impressive impacts from the early clinics in terms of helping farmers in places as diverse as Bolivia and Bangladesh to get more income and raise their income. And what was really encouraging was that they were investing that extra income back into their farms, in the education of their children, and in producing or introducing better sanitation, better running water into their own houses. So a lovely virtuous circle of better farms, better health, better education. And we looked at the concept and said, how can we take this big? How can we think global about it whilst still acting local? So we developed the concept of Plantwise, which wasn't just about clinics, but it was about gathering the data from the clinics and putting that data into a global knowledge bank so that we could get a worldwide picture of how pests and diseases were likely to affect crops around the world as climate changed, as trade flows increased, and as people moved around and carried those pests and diseases with them. We estimate that we've helped nearly 1 million farmers worldwide with this now, and our ambition is to go on to cover at least 40 countries, and by 2016 to have helped 5 million farmers through this concept. What's been changing over the last 18 to 24 months is using mobile communications as a way of really augmenting what the clinics can do in terms of their reach, and also following up on the advice that we've given people. And we do see that as being a real game changer in the future.